Okay, I want to continue with the scalenes here. Another structure I want to add is the nerve tissue. Okay, so the brachial plexus also, let me get rid of the blood vessels here. It's getting a little busy. Okay, the brachial plexus also goes through the scalenes. Okay, and also the omohyoid is a potential here for getting tight and spasm and causing problems to the brachial plexus. All right. So clinically, if a person's arm goes numb and or loss or poor circulation, be sure to look at the scalenes. Okay. Be sure to do certain thoracic outlet syndrome tests to see if there's entrapment of the brachial plexus and the subclavian artery, and then the soft tissue work would apply to start to calm down the scalene muscles. When you release them, it will unkink the tubes. Okay, so keep in mind this is a neck injury, and scalenes will spasm, which means it can bite down on the subclavian artery and the brachial plexus, and the patient will be symptomatic down their arm. Numbness and tingling because of nerve stuff, and then cold and clammy, poor circulation. The arm can be pale and or blue. Okay. All right, on page 411, excuse me, the next page, 413. All right, let's look at the Linea Alba. So let's get to the abdominal area. Okay, so this is the Linea Alba and the Rectus sheath right here. And let's peel back a layer so we can see the Rectus Abdominus. Okay, the Rectus Abdominus. Okay, the origin of the Rectus Abdominus is the pubic symphysis. Okay, so let's isolate it so you can see this. So origin, pubic symphysis, or the pubic bone area, and the insertion is on the xiphoid process and the inferior ribs. Okay, so let's add the ribs. Okay, you can see there. It's a long muscle. Okay, its action is flexion of the spine. So when you contract the abs, the abdominal, the rectus abdominis, you have flexion at the spine. Okay, on 415, you're going to, so jump there in your notes, 415. Okay, here's the transverse abdominis. Okay, transverse abdominis. Its origin is the lumbar fascia and posterior ribs. As you can see there, lumbar fascia and posterior ribs. And its insertion goes to the front all the way up to the xiphoid process. So let's isolate it. All the way up to the xiphoid process in the Linea Alba. Okay. Its action is to help compress the abdomen. So this is the so-called lumbar belt. Okay, very important that this be strong for core strengthening. Very, very important. Okay, the fibers run in the transverse plane, so that's why they call it the transverse abdominis. Okay, let's add some muscles here. So here we have the internal abdominal obliques. Okay, and notice the fibers are running up, and its origin is iliac crest. Let's isolate it so you can see that. So iliac crest, and the insertion is on rib 10 through 12. Okay, and then up to the xiphoid process. And its action is to flex and rotate the spine. It helps you flex and rotate the spine. Okay, so let's add some muscles here. And we should have the external obliques. So they're on the outside. You peel those away, you have the internal. You peel those away, you have the transverse abdominus. Alright, the external obliques. Origin, ribs 5 through 12, so let's isolate it. Okay. Insertion. Insertion is iliac crest, as you can see there, down to the pubis. And its action is flex and rotate the spine.